Symptoms of a heart attack can include chest pain, a sensation of pressure, tightness or squeezing in the center of your chest. Pain in other parts of the body. It can feel as if the pain is traveling from your chest to your arms. Usually the left arm is affected, but it can affect both arms, jaw, neck, back and abdomen. Feeling lightheaded or dizzy. Sweating. Shortness of breath. Feeling sick, nausea, or being sick, vomiting. An overwhelming sense of anxiety, similar to having a panic attack. Coughing or wheezing. Although the chest pain is often severe, some people may only experience minor pain, similar to indigestion. In some cases, there may not be any chest pain at all, especially in women, the elderly and people with diabetes. It's the overall pattern of symptoms that helps to determine whether you are having a heart attack. Chest pain or discomfort. Chest pain is the most common heart attack symptom, but some women may experience it differently than men. It may feel like a squeezing or fullness, and the pain can be anywhere in the chest, not just on the left side. It's usually truly uncomfortable during a heart attack, says cardiologist Rita Redberg, MD, Director of Women's Cardiovascular Services at the University of California, San Francisco. It feels like a vice being tightened. Pain in your arms, back, neck, or jaw. This type of pain is more common in women than in men. It may confuse women who expect their pain to be focused on their chest and left arm, not their back or jaw. The pain can be gradual or sudden, and it may wax and wane before becoming intense. If you're asleep, it may wake you up. You should report any not typical or unexplained symptoms in any part of your body above your waist to your doctor or other healthcare provider, says cardiologist C. Noel Berry-Mers, MD, Director of the Barbara Streisand Women's Heart Center at Cedars-Sinai Medical Center in Los Angeles. Stomach pain. Sometimes people mistake stomach pain that signals a heart attack with heartburn, the flu, or a stomach ulcer. Other times, women experience severe abdominal pressure that feels like an elephant sitting on your stomach, says cardiologist Nika Goldberg, MD, Medical Director of the Joan H. Tisch Center for Women's Health at NYU Langone Medical Center in New York. Shortness of breath, nausea, or lightheadedness. If you're having trouble breathing for no apparent reason, you could be having a heart attack, especially if you're also having one or more other symptoms. It can feel like you have run a marathon, but you didn't make a move, Goldberg says. Sweating. Breaking out in a nervous, cold sweat is common among women who are having a heart attack. It will feel more like stress-related sweating than perspiration from exercising or spending time outside in the heat. Get it checked out if you don't typically sweat like that and there is no other reason for it, such as heat or hot flashes, Berry-Mers says. Fatigue. Some women who have heart attacks feel extremely tired, even if they've been sitting still for a while or haven't moved much. Patients often complain of a tiredness in the chest, Goldberg says. They say that they can't do simple activities, like walk to the bathroom. Heartburn and/or indigestion. As mentioned above, some people experiencing a heart attack can have belching and burping and describe a feeling of indigestion. Likewise, the pain and pressure of a heart attack may occur in the epigastric or upper middle abdominal area, similar to the pain of heartburn. Upper back pain. The upper back is another common location for spread of the pain from a heart attack. Most commonly, Back pain that stems from a heart attack is described as occurring between the shoulder blades. General malaise, vague feeling of illness. A feeling of being generally unwell or like you are coming down with an illness can accompany a heart attack. This can be described as fatigue or even lightheadedness, with or without fainting. Some people will experience severe anxiety or panic during the heart attack. This has been described as feeling a sense of doom, as one experiences with a panic attack. No symptoms. Approximately 1/4 of all heart attacks are silent, without chest pain or new symptoms, and silent heart attacks are especially common among patients with diabetes mellitus. Even though the symptoms of a heart attack at times can be vague and mild, it is important to remember that heart attacks producing no symptoms or only mild symptoms can be just as serious and life-threatening as heart attacks that cause severe chest pain. Too often patients attribute heart attack symptoms to anxiety, indigestion, fatigue, or stress, and consequently delay seeking prompt medical attention. One cannot overemphasize the importance of seeking prompt medical attention in the presence of symptoms that suggest a heart attack. Early diagnosis and treatment saves lives, and delays in reaching medical assistance can be fatal. A delay in treatment can lead to permanently reduced function of the heart due to more extensive damage to the heart muscle. Death also may occur as a result of the sudden onset of arrhythmias such as ventricular fibrillation,